All right, let's talk about something that will either make you a strong nurse or leave you constantly guessing, and that is pathophysiology. Here is why this matters to you. If you don't understand what is happening inside the body, you will spend your entire career memorizing instead of actually thinking. And nursing is not about memorization. It is about understanding. Pathophysiology simply means what went wrong in the body and why. So instead of asking, what is the diagnosis? I want you to start asking, what changed? What caused it? And what is the body trying to do to fix it? Let's walk through this. Every disease process follows a pattern. First, something disrupts normal function. This could be infection, inflammation, genetics, trauma, or lifestyle. Second, the body tries to compensate. And this is where most students get confused, because symptoms are often the body trying to survive, not the disease itself. For example, a patient with low oxygen may start breathing faster. That is not the problem. That is the body trying to fix the problem. Third, if compensation fails, the patient begins to decline. And this is where nurses come in. Your job is to recognize, is the body compensating or failing? Let me give you a clinical pearl. If you only treat the symptom, you will miss the diagnosis. But if you understand the pathophysiology, you will always know what to do next. So instead of memorizing, give oxygen. Ask, why does this patient need oxygen? Instead of memorizing, blood pressure is high. Ask, what is driving that pressure up? That shift, from memorizing to understanding, is what separates average nurses from great ones. Now let's see if you really understand this. Let's move into a quick quiz. Question 1. A patient presents with tachycardia and hypotension after blood loss. What is the most accurate explanation of what is happening? A. The heart is failing. B. The body is compensating for decreased circulating volume. C. The patient is stable. D. The blood pressure is not important. Correct. Answer. B. Here is why that is correct. The body increases heart rate to maintain cardiac output when volume is low. This is a compensatory response, not failure. Question 2. A patient with respiratory distress is breathing rapidly. What should the nurse recognize first? A. The patient needs sedation. B. The patient is compensating for impaired oxygenation. C. The patient is anxious. D. The patient is stable. Correct answer. B. Rationale. Rapid breathing is often the body trying to correct oxygen or CO2 imbalance, not just anxiety. Question 3. Which statement best reflects understanding of pathophysiology? A. Memorizing symptoms is enough. B. Treating numbers is the priority. C. Understanding the underlying process guides care. D. All diseases are treated the same. Correct answer. C. Rationale. When you understand the mechanism, you can anticipate complications and intervene early. Question 4. A patient's condition worsens despite initial compensation. What does this indicate? A. Recovery. B. Stable condition. C. Decompensation. D. Normal aging. Correct answer. C. Rationale. When compensatory mechanisms fail, the patient begins to decline. This is when urgent intervention is needed. Question 5. What is the nurse's primary role in pathophysiology? A. Memorize lab values. B. Follow orders only. C. Recognize patterns and intervene early. D. Wait for diagnosis. Correct answer. C. Rationale. Nurses are the first line in recognizing deterioration based on understanding body responses. At NurseLearn, our goal is to help you succeed, Sign up today at nurselearn.co.